Assalamualaikum warahmatullahi wabarakatuh and good day to Cik Faizal. So before I start to present our topic osteosarcoma, I would like to introduce myself. My name is Muhammad Taha bin Hamidun. This is my student ID number is 2023475704. So this is the outlines. This is the outline for our presentations. I will start with introductions first. So what is the osteosarcoma? Osteosarcoma is a type of primary bone cancer. The metaphysis of long tubular bones such as the proximal humerus, distal femur, and proximal tibia. It's common with osteosarcoma, although it is uncommon in the spine, pelvis, and sacrum. So the etiology of sarcoma, the cause is still unknown. Traditionally, study aimed at determining the origin of osteosarcoma has focused on variety of factors, including genetic, epidemiology, and the environment. So next, the sign and symptom of osteosarcoma. First, the bone and joint pain. Pain might be come and go, can be mistaken for growing pains. The next, swelling near a bone. This may be intermittent and can be related to a bone that break for no clear reason. So the third sign and symptom is a limited movement. The osteosarcoma can cause a restricted movement in the affected limb, such as a limb. Next, a bone fracture, although actually not common, but osteosarcoma weak the bone, it develop in leading to fracture. The next, a redness and warm at the site of tumor. The last symptom is anemia, fever, exhaustion, and unexplained weight loss. So this is the risk factor for the osteosarcoma. First, the age. The risk factor of osteosarcoma is the high risk. The age is 10 to 30 years old, especially during the teenage growth spurt. The risk decrease in the middle age, but rise again in older, usually over the age of 60. The next is a genetic factor. Certain inherited syndromes such as the hereditary retinoblastoma, Bloom syndrome, Lifraumeni syndrome, Rothman-Thompson syndrome, and Werner syndrome can increase the risk of osteosarcoma. Next, the non-cancerous bone disease. Conditions like a Paget disease of the bone and fibrosis dysplasia can increase the risk of develop osteosarcoma. Priority treatment with radiation therapy and chemotherapy. People who have undergone the radiation therapy or chemotherapy for priority bone cancer have a high risk for develop osteosarcoma. The last, the gender. Male are more likely to develop osteosarcoma, although the reason for this is not well understood. So this is the imaging modality to detect the osteosarcoma. First, the imaging modality is X-ray. So the X-ray is the initial imaging modality for diagnose osteosarcoma. It can show the characteristic features such as sunburn appearance, periods, still lifting with formation of Codman triangle, and new bone formations in the soft tissue. The sensitivity of X-ray examination for differentiate benign and malignant bone mass was found to be a 63.4% for sensitivity, and for specificity is 0.8%. 0.8%. Actually, sensitivity this is to differentiate 0.8% is differentiate benign and malignant bone mass. So for X-ray have advantage and disadvantage. The advantage of X-ray is radiation dose received by patient during the X-ray examination is small and can cause a minimal damage to the body. In addition, it is relatively affordable by most patients, and it is a preferred tool for preliminary screening for lesions and for diagnosis. So the disadvantage is a low density resolution, does not clear display in the tiny bone damage and the soft tissue mass, as well as the tumor invasions of bone marrow and callus soft tissue mass and the surrounding structure. Okay, so the next imaging modality is the MRI. This is because the MRI is very important to determine the cancer stage and preoperative planning for surgical treatment for osteosarcoma. This is because it can accurately display the intramedullary range of tumor size and soft tissue mass and the surrounding structure. So MRI offer the sensitivity was calculated as 88.2%, and the specificity as 98.6%, and the diagnostic accuracy is 96.7%. So the advantage for MRI, um, it can demonstrate the tumor in joint and invasions to the neurovascular structure. Uh, Next, it can define accurate surgical boundary and provide a reference for feasibility of limb salvage surgery. MRI is the most sensitive to detect a skip mats, show relationship between tumor and adjacent soft tissue joint vascular bundle. So the disadvantage of MRI is MRI signal is not high, and the display of the periosteal reaction and Codman triangle is not good as a CT. So for the appropriate imaging modality is MRI. This is because the MRI offer the sensitivity was calculated at 88.2% for specificity as 97.6%, and then diagnostic accuracy as 66.7%. According to the provide search result, MRI is the preferred imaging modality for the further characterizing tumor bulk and extent of local invasions in osteosarcoma. However, the recommended initial imaging test for osteosarcoma is a plain radiography for the primary site and the MRI of the entire bone. Therefore, while both MRI and CT scan are useful in detect osteosarcoma, MRI is preferred for further characterizations of tumor, and the plain radiography is recommended for the initial imaging test. So next is a radiographic appearance. Um, okay. So as you can see, the figure one is the X-ray of knee joint. Actually, for figure one, code main triangle show the osteometric and aggressive peris, periosteal seen in the mid femur on the lateral side, which is this here. Okay. However, there is a bone tumor with a white bone transitions at the distal femur above the lateral condyle of osteo here, lateral osteometry and aggressive periosteal reactions. Codman triangle is arrow here at the distal femur. So this is a radiography appearance. The next for MRI knee joint. As you can see, the figure 2 MRI image show the tumor involve the bone marrow cortex and the soft tissue component here at the 1/3 of proximal tibia. So this is the complication. The potential of complication for osteosarcoma is a lung mets. The estimates 60% do not show the significance of lung mets. The presence of mets is a clear indication of poor prognosis. The treatment for lung mets is a chemotherapy, radiotherapy, and immunotherapy, and a gene therapy. So this is for technical considerations for X-ray. So firstly, ensure the clinical information of osteosarcoma locations before perform the procedure. So next, patient in supine position, use a grid to reduce the scattered radiation to get a better image. Provide the immobilized device to stabilize and minimize the motions. Align the central ray to the location of osteosarcoma. Collimation on the region of interest. Explain to patient to ensure the patient cooperate and give the radiation protection to patient. And exposure, give the optimal KVP and high MAS to reduce exposure time to get a better image and high resolution image. So next, the technical consideration for MRI. For patient positioning, patient in supine or prone, depending on tumor locations, use a appropriate immobilization device such as a foam pad or sponge to minimize the patient moving. Provide the headrest and cushion to support head and neck body to ensure the stability and the comfort. For the exposure factor, beside that, the pulse sequence for preferred is T1 and T2, T1, T2, and stir to highlight the specific tissue of tumor. Adjust the matrix size, slice of thickness and gap. Apply the fat suppressions and the motion artifact reduction to get the high resolution image. So the best differentiate between tumor and soft tissue. Use a contrast agent, gadolinium, to visualize a vascularization and tumor enhancement. So for the conclusions, in the osteosarcoma is the most primary malignant of bone, often affecting children, adult, and young adult. MRI is the preferred imaging modality for the characterizing tumor bulk and extent of the local invasions in osteosarcoma. This is our reference. Okay, that's all. Thank you. So, Mr. Faizullah, any questions?
Okay, I have one question.
Yes.
What is the initial modalities for detect osteosarcoma?
Okay, so for the initial modality to detect osteosarcoma is the plain radiography. This is because the X-ray have a high spatial resolution, can comprehensively uh, display the size and locations of the tumor as well as the extent of bone destructions. Cause it also help visualize even like a periosteal and the Codman triangles. Okay.
Okay, can I have one more question?
Yes.
What is the complication for osteosarcoma?
Okay, so the potential of complication of osteosarcoma is a lung mets. Estimate a 60% do not show any significance of the lung mets. The presence of mets is clear indication of poor prognosis. That's all. Okay. Thank you, Cik Faizal.